Hi there, class. Good morning. Due to COVID-19, we are now doing Zoom. So, with all that's going on, I am doing Zoom with you like this on my phone. We'll take it day by day. We will get through this together. Any questions or concerns, you can come to me. I will help you as best I can. So getting right into our lesson plan and our plan for today. I know last week we went over the nitrous oxide lecture. We had good discussions about that. Everybody took good notes before we went on to Zoom. So due to not having Zoom correctly for this, I will be having a lesson plan and everything that we are doing on paper. So it might look backwards in the phone. No worries, I will describe everything hopefully clear enough for everybody to understand. If I could have everybody turn on their cameras. Okay, so our lesson plan today, it's backwards, but like I said, I will describe it all to you. So our lesson plan today for pain management, this is the lecture, lab will be after. So today we have a pop quiz. Fun. I will go through how we will be doing that today. It's just a simple 10 questions. We will be doing good. Then after that, it says we will be doing lectures on our last injection, the nasopalatine. It's also known as the NP. We'll be doing that in clinic as well. And so we will just go over a couple bullet points on that. And then afterwards, I have us doing injections categories. Does anybody know categories? That fun dice game where you pick a letter from the dice, and then every word that is correlated with that letter has to go with that word. It's pretty fun. So we will be doing that with injections today. So to begin, while everybody gets settled, it's just a quick 10 questions. Just want to kind of gauge where everybody is at. If you have any questions from these kind of questions on the pop quiz, feel free to ask me in the chat. I'll be chatting with you, or you can email me. So everybody is ready. And so this is when I would play our fun Kahoot. It's a Kahoot that can grade everybody. I can go back and see everybody's grade on there. It says, pretend a Kahoot is playing 10 questions. And then cue the Kahoot music. I don't know how to do it. Okay, great. I'm so glad everybody did that. Any questions or concerns, ask me about that. So we will go ahead and talk about the nasopalatine, also known as the NP. That is getting the canine to canine. We went over all the other injections. Let me just get my screen pulled up here. And then everybody can see my screen, I'm so sure. All right, so let me also get set up. Everybody doing okay? Good. Perfect. Okay, so talking about the nasopalatine, also known as the NP. Some things to make sure you know about this one. You'll be asked to know this in clinic. You'll be asked to know this in lab. It's just good to know for future reference. And here's a picture. Maybe I'll show my screen. Can I do that? I can't do that on the video. Apologies. Maybe I'll show what I'm doing. All right, so I would show them this picture and all this information, and we will be going over all of that. My hair fell out. Okay, let's act professional, Jenna. Okay, so the nasopalatine, the NP, some good things to know about this one is bevel to the bone. And also we want to contact the bone millimeters deep with the needle. And then pressure anesthesia, if you remember from the GP, you also want pressure anesthesia for 30 seconds prior to and during the injection. So with your non-dominant hand, that's usually you'll be doing the cotton swab, and then with your dominant hand, you'll be doing the syringe. So contact pressure, syringe. Bevel to the bone, all simultaneously doing these motions. So the nasopalatine anesthetize the nasopalatine nerve bilaterally. So by doing one side of the injection, it anesthetizes canine to canine, which is bilaterally due to the midline. The landmarks for this injection is the incisive foramen, the incisive papilla, and the central incisors. Everybody, any questions so far? We're doing good. Okay, and then areas anesthetized, like I said, maxillary canine to canine. Okay, and the structures anesthetized is the lingual mucosa and osseous tissue. So that's getting everything. The bone, the gingiva, everything like that. The pulp, the nerves, all of it. The penetration site is the palatal mucosa lateral to the base of the incisive papilla. So when that means is you take like the incisive papilla, we come laterally to that, either side, sometimes both. So yes, path of penetration. So with this one, finding a good seating position where you are doing good ergonomics as well, but you're also being able to see, having that patient tip their chin way back. 11 o'clock really works for this. Or if you're a left-handed, that would be 1. So we want to come at a 45-degree angle towards the incisive papilla, and it says operator positioned at 11 o'clock or 1 o'clock. We want to come at that 45-degree angle with our dominant hand. Non-dominant hand has the cotton swab doing pressure anesthesia for 30 seconds during and prior. So the depth of our insertion is about 2 to 3 millimeters, very, very tiny. You're gonna contact bone about 3 millimeters. And with this one, you're gonna use a 27 gauge short needle. So these are all things in lab that we will have you cite back to us. And the amount deposited, this is a very small amount. It's about 1/4 of a carpule max. We won't go any more than that. Patient really doesn't need any more than that. And last one is the terminal deposition site. So that would be 2 to 3 millimeters from the penetration site towards the middle of the incisive foramen. So in that incisive papilla area, we have that incisive foramen, which the anesthesia is going into to help anesthetize the pulp. And like I said, this is maxillary canine to canine. You want to know the bevel to the bone, just like all the other injections that we talked about. And really just knowing that you're going to contact bone within millimeters of the needle, and then the pressure anesthesia. You want to know that as well. Any questions? Any comments, concerns? No? Perfect. Good job. All right. So we kind of got all of the injections now talked about. We have 10, but for the purpose of this, we have 9. So now we will, with the last roughly, 10 minutes of our class, we will be doing the injections categories. So it's kind of interesting and fun. In the classroom, what I would do is I would have students, we would kind of number off between 1 and 10 or 1 and 9. So everybody would be different. I would put the names of the injections on different tables, 9 tables, and then students from a group would go to their assigned table, and I don't know, maybe a minute into it, 2 minutes into it, they would switch, go counterclockwise, clockwise, and then we would go through every one, and I would just have them write everything that you should know, need to know about that certain injection. Maybe it would take 3 minutes, 4 minutes for each one, just depending on how many students we have. Just being mindful of how fast people write. It takes time to think. This is something that I want to be quick on their feet, but I also want them to think about something that's really important regarding this, such as bevel to the bone, contact anesthesia, making sure that every single one we're writing aspirate, especially with the ILB, you're aspirating 3 times. So yeah, it'd be easier in a classroom due to the video and how we will be doing it on Zoom. I'm just gonna ask. So I'm gonna mix up these injections, and we'll give about a couple seconds due to the video. And write down, I'll hold it up and write down everything or anything that you think is important, that you need to know, that you really want to know. Make sure you have down pat, so that when it comes time to injection, you feel confident what you're saying, because when you are talking and you feel confident, you give that injection with confidence. And so I think this is going to build up a confidence within the students that they won't feel so intimidated with what they have to say, due to I have felt that in the past. Okay, so the first one we're going to talk about is SPO. A couple seconds here. Everything you need to know. Good. And this will be something that you guys can keep. I won't ask for it back. It's just a reminder to you, and then you can always go back and add to it. This is just what you're thinking. And in reality, this would take about 3-4 minutes. We'll just do seconds. All right, next, NP, today. Anything that you think is important, write down. Perfect, great job. Next, we have the GG. Anything important there? Write that down. Good things to write things down is like what quadrant or sextant you would work on this. Anything that you need to know about this one, I would like written down. Next one is MSA. Where would you do that? Anything important about that? Is there a bevel to the bone? Is there how much you're depositing? What teeth are anesthetized? That's a big thing that should be written down for every single one. Next one we have is the ASA. Where's that in the mouth? What's important about this one? Good job. Next one, IALB. We got many letters in there. What do they each mean? What do you have to know about that? Any position with a syringe, anything like that. Good job. We got the GP. Anything important you want to know there? Where is it going in the mouth? What teeth? Is it pulp or is it just buccal bone? Things like that. Keep in mind. always go back and you can always add to it. This is just a good way. PSA. What do we have to know about that? Where is that in the mouth? Good job. And the last one we have for today is the MI. Where can we do that? Good job. All right, class, you guys did so good today. I'm so happy. We went through a lot. We got a lot done. I'll be grading those pop quizzes. It's just a quick 10-minute or 10-point quiz. That'll be easy to grade. Any questions from there? Next week, we will be doing our nitrous and a little bit of the injections quiz. Worth 30 points. Study hard. Anything that you have questions on, reach out to me. I'll be happy to answer. See you next week.